welcome. Welcome everybody. While you're coming in to this webinar, I'm Jada Shapiro from Boober, and that's Lauren Levy from Magnetic Me. And we're gonna talk to you in a moment, but can somebody drop into the chat? Let me know, can you hear us, first of all? Can you give me a little yes if you can hear me out there? And the next thing, yes, fantastic. The next thing while we're waiting for everybody to come in, what I'd love for you all to do is let us know where you live, how many weeks pregnant you are, or if you have a baby. That would be really exciting to kind of see who's out there and who's with us today. So drop that into the chat. How many weeks are you, or how old is your baby? Where do you live? Let us know while we're waiting. Southern Westchester, postpartum doula. We've got 31 weeks today in New Jersey, 28 weeks Kansas, 33 weeks in Hoboken. 27 weeks in Beverly, Mass. Let's see, 36 weeks in Brooklyn, New York, Arkansas, all over, my goodness, Iowa, DC, Maryland, 32 weeks, Brooklyn with a 3-month-old. So we have a lot of people from all over. That's so exciting. Bend, Oregon, Minnesota, amazing. Florida, 21 weeks in Miami, 30.5 weeks, 35 weeks in Philly. This is so exciting, isn't it, Lauren? Very fun to see where you all are. I hope you all feel like part of a community here as you're all going through something similar, and thank you so much for coming. So we're just gonna go ahead, and actually you're still flowing in. I wanna give people a chance to come in, but I think we're good. All right, a few things just to let you know, if you have, before we get started. If you have questions today, which this is mostly going to be driven by you, I have some of the questions you submitted ahead of time, but I want to take your questions on anything pregnancy, birth, postpartum, lactation related to COVID or not also, because you probably have other questions. And just to let you know, there's a Q&A at the bottom of your Zoom. So that is the best place to ask me questions. You can ask in the chat if it's something I'm talking about directly, and I might see it, but sometimes if lots of people are chatting, I won't see all the questions. So there is that Q&A, and that's a great place to type in your questions. So feel free to fill that up. So Lauren, why don't you start by introducing yourself?
Hey everyone, my name is Lauren. I'm one of the co-founders of Magnetic Me. I also live in Southern Westchester, so hello to that person, my neighbor. I have a 6-year-old and I have twin 5-year-olds. And the times of Corona have been a real challenge in my house. I am one of the co-founders of Magnetic Me, and if you haven't heard about us, our goal is to make your life super easy, and we do that with our smart clothes, magnetic fastening infants wear. And we know that having a baby is challenging, and we hope it's the little things like Magnetic Me that makes your life just a little bit easier, especially in the middle of the night, which is fabulous. And I'm so excited to be here with Jada. This is really just fabulous. I mean, I wish we had this kind of information when I was expecting. So Jada is a maternal health expert, also mental health expert, and the founder of Boober, a health tech startup where expectant parents and new families find expert in-person pregnancy, the postpartum care providers like doulas and lactation consultants. She's also founded Birthday Presents, New York City's trusted source for childbirth classes and doula training, which has supported over 20,000 parents since 2002. So thank you, Jada. I really appreciate it.
Yeah, thank you so much for having me. So it's been really great to be able to connect with you all, and been doing a lot of these webinars, and our goal is to make you feel more informed and supported during this time. I'll just tell you a little bit more about Boober first. Boober is a platform where the expectant and new parents can come and find all of their pregnancy to postpartum care providers. We were all about in-person care until COVID came and transformed all of our lives, and we quickly converted everything into virtual. So we are fully able to serve you virtually. The kinds of care providers that are on our platform right now are birth doulas, postpartum doulas, lactation consultants, and mental Okay. Did I come back?
Yeah, we can hear you now.
So sorry, everybody. It happens every now and then where I am. So I should have told you all that. Let's start again, right? We're flowy because I live in birth world. So I was saying the different kind of care providers are birth doulas, postpartum doulas, lactation consultants, and mental health therapists, which we fast tracked due to COVID-19 and all of the uncertainty and anxiety. And, you know, just all of us, you guys are having babies in a really unprecedented time, as you know. And, you know, this is the first time potentially that people are at home really in this way without visitors, helpers, and all of that. So, and things are different in the hospital, but we also know you all can do this and you can get through this. And we're really happy to be able to provide the support that you might need as you're going through this. So if you're kind of like, how could a virtual doula work? What's that? You know, you can ask me about that, because I think virtual care is, you know, more important than ever. And this type of care, when it's the only kind of care, it really makes a huge difference. So we're here for you. I also own another company called Birthday Presence that started 18 years ago. We provide childbirth classes. Somebody asked, one of the questions that came in is, where can I take a newborn care class? So I will introduce you to my other company as well. If you need any kind of classes at all, we have all live, interactive childbirth classes, breastfeeding, newborn care, infant CPR, and all that. Okay. That's me. So let's get started. And one of the things, just to start, I guess I'll just start, you know, with your questions actually, but I'll just talk a little bit. Let's talk about the climate right now, because you are from all over, and there were lots of questions about the future. And I guess we have to start by saying, you know, if you're not due for some time, then it's changing every week. I feel like the protocols and the situations in the hospital are changing a lot. Right now, what's currently happening, if you're in a hotspot area like New York, where we are based, you know, almost all people can have their partner. They are testing everybody as you're coming in. So that is one thing that is happening now. And that is the recommendation of ACOG, the American College of Obstetricians and Gynecologists, is recommending that, you know, people be tested when they arrive in labor. So you should prepare for that and know that that is likely that you would be tested and your partner would be tested. And depending on the rapidity of the test and how long it takes for things to come back, and it can be very varied, 4 hours, 8 hours, sometimes longer, depending where you are and whether they are testing or not. Then if the partner tests positive, in most cases, the partner, you know, would be asked to leave. So one of the things we're just preparing people for who are expectant right now is that there is a possibility that your partner wouldn't be able to be with you if they do test positive, even if they're asymptomatic. And in many cases, you're allowed then to have another support person. So it's a good idea to think about who is your backup support person at this time. Hospital to hospital, whether or not the partner can stay for postpartum. So in a lot of hospitals right now, the rule is about 2 hours after the birth, partner can stay, and then partner would be going home. So that's kind of something to put out there. Other things to think about right now are that, you know, most people in labor right now are being asked to wear their mask. So I'm sure you all have either, you know, a homemade mask at home, or if you don't, depending on where you're living, maybe it's not in that situation yet, but certainly where we are, you know, we are social distancing completely, and when we go out, need to wear a mask. And so if you are in a place where that has not been mandated yet, people asked, one of the questions that came in is, how should I protect myself as a pregnant person right now? And what we would say to you is absolutely to be practicing social distancing as somebody who lives in a place where we didn't practice it early enough, and we are really struggling with the effects of that. I do urge you to really, really do that. If, you know, follow those rules, stay at home, and really do what you can to minimize your contact with people. So for most pregnant people right now, a lot of visits have turned to telehealth besides the critical visits. So back to what I was saying about the mask is that, you know, in New York City, even if you test negative, because it takes some time, because some tests could be false potentially, they are asking that everybody labor in a mask. So that's one of the pieces of advice that I would give to all of you if you're pregnant, is that you want to start getting really comfortable with your mask. Put it on multiple times per day inside your home.
and just breathe and be in it and start to feel like, what is that like? How do I do this? At Birthday Presents, we're doing a lot of different pain coping classes that are specific just to labor, like 1-hour classes where you can come practice guided visualization and breathing, for instance. And now what I'm doing is I'm having my students actually put on the mask, and we're just doing some exercises during that time with the mask on. So I think that the more you can practice wearing it, knowing that it's going to feel hot and it's going to feel humid, and that's going to be one of the potentially negative sensations that you may experience during labor, but being able to work through that, the more you do it ahead of time and the more you get used to that is going to make it a lot easier. Okay, so that's just one of the tips I'm giving out currently. A lot of people have the question, what happens with my newborn after the birth, right? So if you do have after the birth, if you test positive, it depends on what hospital you're in. And I would urge you, if you're near your due date, if you're not yet, you don't need to know this, because again, this is changing every week, every 3 weeks, it can change a lot. So I wouldn't get too concerned about something unless you're due in the next few weeks. And then you definitely do want to know what the plan is. So if you're testing positive right now, some people are saying that you should not actually have the baby in skin to skin contact and that you should be separated from the baby. So some hospitals are requiring that, although you could communicate with your care provider about whether that's right for you in your situation. The big question a lot of people have, can I breastfeed if I am COVID positive or I am status unknown? And yes, breastfeeding is being recommended right now. They don't believe that the virus is in the breast milk. That is not so far what they have found. So they're confidently recommending that everybody can breastfeed. The question is, how is it, how are we transmitting and what is the risk to our baby? And the real issue, I'll just grab my baby here, is the droplets. We are in very intimate contact with the baby, right? So it is passed from nose and mouth droplets in this kind of intimate contact or through touch on my hands. So if you are positive, then you're always going to want to be washing your hands very well, following proper hand hygiene, or you could use gloves, wearing a mask when you breastfeed, or the alternative is during that time period to express your breast milk using a pump, washing your hands, cleaning the pump, all of that, right? And then having a healthy person, if you have that person in your home or at the hospital, the nurse or your partner, if they're negative, would then feed the baby a bottle at that time. So that's what's going on. But some hospitals, even in New York, are not doing this separation automatically. They're assessing case by case. So it's a really good thing to ask your care provider. The more things you know up front as you're getting close, the more possible things you can anticipate and prepare for. I think that helps it be a little bit easier. One thing that a lot of pediatricians I've been talking with and interviewing have said, though, if you have a baby at home, and I know some of you have babies at home, or you will, that it's fine to go about your normal life. You don't have to wear a mask all the time inside if you do not have the disease, right? But if you started to feel a sensation of getting ill, which could, of course, for many people, it's allergies. It's going to become allergy season. People will have a tickle in their throat. They won't be sure. But the pediatricians are suggesting that, the most cautious thing you could do would be to mask up and use always use the really good hand hygiene. But that would be something that is being recommended if you're in that uncertain phase until you can determine, oh yes, it is allergies and it's fine, or if you were to be getting something. So that's just something I want to put out there. So let me just look at some of the questions and ask questions, and please bring them on. So what happens at the 6-week postpartum checkup? I had a natural birth and I feel fine physically. My doctor is in the city and I do not want to take a cab during COVID. Can I change provider for this appointment, or can I skip this checkup altogether? That is a really great question. So let's talk in general about, postpartum care, what's happening, preparing for postpartum, what kind of things do you need at home, and do you have to go to that visit? So most care providers are, reducing the amount of visits that you have to go to and doing a ton of visits, as many as possible in a telehealth way. The 6-week visit, you asked, can I go to a different provider that is not in the city? You could certainly ask, you could certainly check in. I would imagine that you could do that. Some places are not taking new patients as of right now. Some pediatricians are not, but if you are well and just having a well visit, it is certainly a possibility. You would potentially need to get your clinical medical records from your current doctor. So you can do that. That is your property, and you can definitely do that if you can find somebody. And I think if that makes you more comfortable and then you don't have to travel into the city, that makes a lot of sense to see if there's somebody else. The downside of it is, of course, that they'd have to look at your chart, but they don't necessarily know you in the same way that your care provider does. But I think we're all about balancing out these questions and choices. The key thing that we're looking at, though, in the postpartum phase, and why, does anybody out there, actually, I'm just gonna ask you guys if you want in the chat, let me know, does anybody have a blood pressure cuff at home? Has anybody's OB or midwife asked them to get that at home and to have that? Yes, I was told to buy one. I have one. Yes. All right. So that never happened before. That was not a thing for the most part. And right now, yep, I see that a lot of you have the blood pressure cuff. Great. So if you have that, that's very useful then for postpartum, because you can develop something called preeclampsia, but postpartum preeclampsia after or dangerously high blood pressure. And that's something that we really need to know about. And if you don't have a blood pressure cuff at home, then if you are feeling off or not feeling great, that's going to be a reason you're going to have to travel and get seen by somebody. But if you have the blood pressure cuff and you're able to check yourself with the guidance of your care provider, that can really, really make a difference. I think talk to your OB, and everybody out there can talk to their care provider and ask, are you doing the postpartum 3 to 6 week visit? ACOG recently, actually 2 years ago, they recommended that we should start doing postpartum care earlier than 6 weeks, because in the US we actually have, we leave people alone for 6 weeks, which is a really long time. So a lot of care providers have shifted to doing the postpartum visit at around 2 to 3 weeks, actually. So I would ask, somewhere between that 3 to 6 week phase, ask what they would do, what do they need to see. They're going to want to know how much you're bleeding, right? You might need to be prepared to show a saved pad, honestly. And that's what we do is, we don't do that. The medical doctors, they'll show me. That's what we do. I was going to say, as virtual care providers, we're often looking at things like, if you're going to ask me questions about how my baby's doing and are they eliminating enough? And I'll say, can I see the poopy diaper, right? Or a postpartum doula might want to, you might want to show them your cesarean birth scar, or if you have a C-section scar, or other things. And again, we're non-clinical care providers, but we might suggest to you, oh, you should definitely call the doctor about that. We'll probably suggest that to you if you're asking any medical questions, of course, that we're going to refer that back. But we can help you kind of get a sense of what's normal and what's not normal. All right. How many types of newborn and infant clothes do we need, and what quantity? Like tops, pants, onesies, all of that. That's a great question. Since we're not going, actually I should let Lauren answer that since you're here.
I can help with that. So I don't think you're going to find a list on the internet. I think that's why a lot of people have this question. So it really depends on your lifestyle and your access to a washer and dryer, basically. And if you have a baby that spits up a lot. So the first, month or so, you're going to be changing, no, longer than that. You're going to be changing a baby quite often. I would say minimum 2 to 3 times a day. So I think you're going to want to get a few outfits. So assume if it's 2 to 3 outfits, you go 3 days without washing, and then calculate it that way. But I wouldn't buy ahead of time because babies grow so quickly. We actually have, our tags are marked by height and weight. So if you have a newborn that's, on the larger size or the smaller size, we definitely recommend you buy by the child's size.
Well, thank you. Yeah, it's hard to figure all of that out, but I think it is interesting as a COVID-19 aspect. Well, maybe many of you have a washer dryer. If you're not in New York, that is, many of us do not, many people do not. And right now people without washer dryers are doing a lot of hand washing, right? In which case, okay, you have a washer dryer at home. Yeah. So you have you don't need to buy quite as much. Like my sister, who currently has 50 pairs of underwear, because she was just like, I'm just I'm not going to be able to go out and wash them, right? So those of you without washer dryer might be buying more, a little more than before. But let's see. So have there been any updates in research of corona impact on pregnant women and their future babies that might not be available to the general public? And many questions have come in, about that essentially, we're still, as far as the CDC has reported and ACOG, that we're not seeing an increased risk of vertical transmission, meaning we're not seeing that from the pregnant person to the baby. So that's really good news. And the real risk is the transmission is after, when the baby is here, if we have it, or if a visitor does come over, you know. And they're not saying that pregnant people are any more susceptible to getting the virus, but that when we are pregnant, we may have a higher, harder reaction to various viruses, is what you know, significantly and historically has shown. So the best advice that everybody is giving right now is, if you are pregnant, to really be practicing the social distancing, and to remember that just recently they are starting to realize that the spread of the virus was here much earlier than they thought, because it is a silent spreader in so many ways. And so if you are in an area where it seems like everything's fine and you don't know anybody personally who has been sick, it creeps up very fast. So I think for pregnant people right now, the best advice is to wash your hands not as frequently as possible, but to wash your hands frequently, the 20 seconds, you know, and go on the CDC site. At Boober, if you go to getboober.com, we have our COVID resources page, which has all of the CDC recommendations and all the blog posts that we've written about this, and more of the webinars. And if you want to watch the webinars with the OBGYN, you can visit us at our YouTube page. Get Boober has all of those, so you can go back and look at that. People also asked about infants and how are infants faring, and so far that the very good news and the silver lining of this is that infants are faring very well, and basically there's very, very, very few cases of infants having the illness that we know of. Of course, we're not testing as much, but even in the births that we have heard of in the city, that many times where the parent had been tested positive, the baby has not. So somebody asked for all the mamas out there, all the parents out there who no longer have classes, can you provide a link to all the online classes Boober provides? Yes, I will. Right now, they're all being provided through our sister company, which is Birthday Presents, but that we're also doing some specific classes on through Boober as well. So if you're on either of our mailing lists, you will get all of that, and we will be sending you an email after this as well. Somebody writes, I'm due in June and I won't be able to meet with pediatricians ahead of time to pick one. Does the hospital assign one to me? How does it all work? Yes, the hospital assigns you a pediatrician. So wherever you end up giving birth, and I know a lot of people have left where they live and they're trying to be elsewhere, and so they're unknown. Are they going to come back to the city and have the baby? Are they going to give birth in this other community? So you're always assigned a pediatrician at the hospital. So that's the good news. You don't, I mean, if you didn't have a pediatrician ahead of time, it's okay. Then you'll call around when you have the baby. Not ideal, harder, right, when you have a baby to do anything. So certainly would be preferable if you could try to book somebody ahead of time. I will tell you that the pediatric visits, the only ones that are in person right now, are the very first visit, which is usually day 2 to day 4 or so after you have the baby, and then any of the vaccine visits. So usually at 2 months and 4 months and so on, whenever there would be a vaccine visit scheduled. Those are right now, pediatricians are extremely concerned about that, and they are seeing less people going out to those visits. And pediatricians want us to tell you all that they're or they communicate with you, and then you'll go in after. Oh shoot. You lost me again. Lauren, do you know where I went out? What was I saying?
Sorry, because mine cut out also a little
Oh,
bit.
am I back? Tell me where did we leave off? We missed the part about what pediatricians want us to know. That's important. Thank you for telling me, you guys. That's really helpful. When I go out, I'm sorry about that. Yes, so after the 2-month visit. So I was saying that the visits that they really want you to go to are the whatever visits that they recommend, the AAP vaccine visits. And they're very concerned. Pediatricians are very worried right now that by people skipping those visits, that we're going to see the levels of people getting vaccinated or vaccinating their children going down significantly. I know there's different opinions about vaccines. I'm not going to go deeply into it, but I will tell you that most pediatricians right now are having this concern. And so they are going to deeply stress that you come into the office for your very first visit, because that's really important for them to assess the baby, although they will be assessing the baby as well at the hospital. And I'll tell you about the hospital release in a moment, but that also, that it's important to go back for those other visits. If your baby is ill or sick or acting funky, you know, and you always want to call your pediatrician when you're just, the baby doesn't seem right, doesn't feel right. If the baby were to develop a fever of 100.4, that is the number of degrees that, you know, where they would want you to call. It's important to call, but they don't want anybody just coming into the pediatric office. And almost all sick visits right now will be taken care of through distance, and they can really advise on that. We're also, of course, seeing, at least in the areas that are really being socially distanced, we're seeing way less illness because nobody is mixing. And so there's less illness that's other illness, not COVID, of course, happening. So the other thing with the pediatric visit, has anybody been told or thought about, does anybody have a scale at home, a baby scale? Anybody thinking about that or have one? I'm just curious if anybody's bought one out there. Normally, no, yeah. A hatch changing pad with a scale, not a specific baby scale. Yes, I got one. So normally I would say do not buy a scale. You don't need it unless there's a clinical concern or reason that you should. It's still not 100% required. I'm just going to put this out there to you as I've been talking with different pediatricians about this. It does make the pediatric visit somewhat, you know, easier as we can watch the progression of the weight. That's one of the ways we know if the baby's breastfeeding enough, right, is through the weight, although we know lots of other ways. We know how much they're peeing and pooping also really tells us, and if you come to lactation class, we'll go deeply into this, how much they're peeing and pooping tells us a lot more about, you know, how the baby's doing, how they're gaining. That's really the primary way. You can also watch that the baby starts to chunk up a little bit, and you can certainly, somebody recommended, it's an interesting idea because when we're with our baby, we can't really tell, are they growing or not day to day? But you could take photos each day and kind of the same photo and just get a little sense of like how they're filling out and how they're changing. But if you have a food scale or a pastry scale at home in a bowl, like we've seen these adorable, you know, photos of babies kind of curled into these little food scales, which pediatricians are saying is fine, provided you can do it safely, of course. You can also get a general sense if you have a regular scale, an adult scale at home, you can hold your baby and then not hold your baby and take the difference to see, you know, but that's not that would not be useful exactly for breastfeeding if we're trying to get a sense of small amounts of half-ounce weight gain. So it's not that you absolutely have to have it, but if you're having concerns about the baby's weight, then you may need to go in and get the baby weighed. Now, if you do have a scale at home, I'm going to urge you not to overweigh your baby. Only weigh the baby when the virtual lactation consultant has told you to, because they're trying to get a sense of how much your baby's actually eating at the breast, if you need that information, or your pediatrician. If we just go weighing the baby all the time, we really can get stressed because sometimes they'll just gain a little bit and they won't gain that much on one day and then they have a growth spurt. So that's important to remember. Let me look more at questions. So my family is very eager to book travel to visit the new baby. We are due at the end of July. My question is, even after the stay-at-home orders are lifted, how long do you suggest delaying visitors? So some places are going to lift the stay-at-home orders, maybe soon. I don't know, right? Without being too political about this, I mean, from where I live, doesn't seem like a very good idea. Seems very problematic. So if you live in a place where the stay-at-home orders are just lifted and there's no testing and there's no antibody testing, it would be very hard to know if you're going to be exposing. So I'm just going to put that out there. You don't know if you'll be exposed. So I would still personally, if I were doing it, which is just me, we're all about non-judgmental sports. I'm going to give you my opinion, and then I'm going to say, you do you, and you have to talk to your family and your care provider and figure out what works best for you. But I would still say that any visitor, you'd need to know that they were absolutely quarantined for 2 weeks, 14 days, quarantined completely, where they're not coming and going, right? They're not engaging in less than 6 foot of contact with anybody, so that you can be 100% sure. Also, a lot of the visitors we're talking about are grandparents, right? A lot of you have asked, can I have the grandparents? When can I have the grandparents? The grandparents are at the highest risk because of their age. And so there's also the issue, if we're not completely quarantined or practicing, sheltering in and practicing really the highest level of social distancing and hygiene, that we are putting our visitors at risk. So if you have done that, and remember, if you've gone out, you've given birth, you've been out in the world, then you should do a 2-week quarantine yourself before visitors come. That's what we're suggesting. You can certainly talk to your pediatrician, your OB, your midwife, and figure that out for you, but that is what a lot of people are suggesting. So if the grandparents want to visit from elsewhere, they would come travel. Maybe they need to rent a place or stay in an environment somewhere where they can be quarantined for 2 weeks near you, and then you can start to talk about the combining of the bubbles. It's a really, really challenging situation. Let's talk a little bit about the circles of support that you're developing for yourself, right? As you have a baby. You want to really think about that. I have a class at Birthday Presents called the Preparing for Postpartum during COVID-19, where I'll spend an hour on this, so feel free to come by to that. But some of the tips I can just give you right now are, think about who makes up your circles of support, right? Who are the friends that you can call on in the middle of the night? Even you have to have your daytime and your nighttime list. Who can I actually call? Who can I get on the phone or have a video chat with, who's going to make me feel better, who gets it, who understands postpartum, who maybe has a baby or is just a really good listener, and thinking about that. And then normally I'd be telling you all, think about postpartum doula care. Does anybody out here know what a postpartum doula is? Can I get a sense? Have you ever heard of it? I know that helps me. If you haven't, let me know. It'll tell me how much I should really explain. Okay, I see some people who say no, and some people, nope, yep, somebody attended my class last night, heard of it. So we've got a good mixed business. So I'm going to tell you a little bit about postpartum doulas. Postpartum doulas are essentially, we help parents transition to parenthood. We mother the mother, we nurture the birthing parent, we take care of the whole family unit. We are kind of recreating the traditional way. If you look in all society, right, almost all places besides the US really, and even the US some hundreds of years ago, earlier, everybody, when they give birth, they normally have this 30 to 40 day period almost. You can call it like confinement or the lying in. You'll hear all these different terms, right? Where people, family members, historically mostly women, surrounded the birthing parent and fed them nice warm soups and nourishing foods, and held their baby and took care of their baby and taught them all the things that they don't know yet, like how to worked on breastfeeding with them if they had any issues, right? Helped them heal their bodies, took care of them, held their babies while they slept. So all of that. And in a lot of our cities anyway, a lot of people don't live near their families and don't have family coming over. And now we're all in that boat, not having, maybe if we have a safe way to do it, we will have somebody come over, but many of us are not going to have help in the first few weeks. And the virtual postpartum doula really makes a huge difference. Now, how does it work, right? What can I do for you virtually? I can talk to you, I can listen. We're experts in newborn baby care. We can show you the first bath and be with you to do that. We can help you figure out how to swaddle or how to put the onesie on, although with your magnetic knee ones, they're pretty easy. I don't have to, right? I can show you how to baby wear. I just did a baby wearing session with somebody who couldn't figure out their baby carrier, and I'm able to stand here with my version of your carrier and we work together. I can listen to you cry. I can listen to you laugh. I can hear what I can listen about your birth story, and that's really valuable. And I can make suggestions, and I can tell you what foods might be really supportive to you right now. Although I can't make them for you, I can certainly make suggestions. You can try a virtual postpartum doula without, you can either book somebody in advance, and that would be at Boober, right? You can fill out, we have a postpartum doula page. You fill out a form. Right now, we're just shifting the page actually. I think today it might even be different, where I really want people to be able to If you just need 90-minute session with somebody, you can just book that today on demand. You don't need to make a big plan. You know, right now it's so up in the air. People are like, how does this work virtually? So try it out, you know, work with somebody for an hour, see if it feels like a good fit. But we're basically, it's like we're the friend or family member, but without any baggage, who's super knowledgeable about babies, breastfeeding, you know, how to clip the baby's nails. And it's been really, really amazing being able to come into people's homes. Now, let's say you book a 4-hour visit. In the old days, which was just 6 weeks ago, I would have come over, you know, to your home and maybe stayed with you for 4 hours, right? Now, do we want to do a 4-hour Zoom? Maybe not. It might be that I pop in for an hour every other hour. And just like, or every 2 hours, or you text me and we check in and we decide when you want me to pop in or when you have questions. You know, so we can even be with you there, you know, late at night if you just need to talk. So we can help you go to sleep. We can do guided visualizations, calm you down. So anyway, you can ask me more about that if you need, but I just really want to put that out there. I think it's a form of support. People are much more familiar with baby nurses who typically care just for the baby, but they don't care for the whole family unit. I mean, not to say that they don't, they certainly could sometimes, but that's not typically, yeah, it does sound amazing, right? So I hope some of you will come visit. Actually, let me give you a little code right now. We have virtual 10. I'm having a hard time typing while I talk to you. Virtual 10 at Get Boober gives you 10% off your first visit. So try us out. We're here for you. All right. Let me continue on with questions. So in mid-June, do I need to buy long sleeve onesies for my newborn, or will they get too hot as the weather gets warmer? How can you tell if the baby is hot and cold? So I'll answer the hot cold part maybe, but why don't you, Lauren, take the long sleeves, or how do you dress a baby?
So the baby needs one more layer of clothing than you are wearing. So if, you know, it depends also where you live. If you live, you know, in Maine, it might be cold in June. So just factor that in, or if you live in the South. But we are, our footy, which is long sleeves with long pants and feet. That's our biggest bread and butter. Babies wear that day in and day out. They're sometimes called sleep in plays. But yeah, that's going to be your staple item. And they're fabulous. Need that.
Thank you. Yeah. And what I was just going to say, how do you know if a baby's too warm or too cold? I love what you said. That's what we always say. Dress a baby one layer warmer than yourself. And then, you know, if a baby is really too cold, they will be chattering. They will shiver. You will feel like their nose is really freezing. Their hands and feet sometimes can be, but they really would shiver. It's rare to get that situation.
And also the air conditioning. Yes. So when their air conditioning is on, it's going to be a little bit chilly.
Right. So, yeah, you got to factor that in. And if they're too hot, which is actually more of a risk factor for them, not that the cold isn't, it's just that doesn't happen as often. We tend to over bundle because we think the baby is maybe too cold. You want to feel the back of their neck, super hot, sweaty. That is a sign that they're too hot. You'll also see the cheeks get really, really flushed, or there might be sweating up here. So if a baby's, you know, some babies run extra hot and they just don't need, you'll get to know your baby, but that's something that we want to watch out for and look for. All right. So another question that we got is my son will be 2 to 3 months old during the anticipated second wave of COVID in the fall. My 2-year-old daughter is set to start attending school a few hours per week in the fall. I'm concerned about potential exposure to COVID and bringing it home to my infant who will not have built up immunity, you know, yet in general. Can you talk about that? You know, I think in general, I'm not even convinced that our kids are going back to school, frankly, in the fall, especially if things do lessen, if we lighten up the regulations in some places. I think we are going to see it's going to quickly climb back up. That would be my sense. And then we are going to potentially not have school again. So, you know, all of us are currently homeschooling. Our kids are going to school online at the moment. And so I don't know, it'll be a question for you to decide as we get closer. I don't think you have to necessarily commit to figuring out if flatten the curve here, at least in New York. I think that so far spouses are allowed in the hospital, and by fall we should hopefully have a lot better testing. And if we have testing that is much more accurate, then we would know, either antibody testing potentially, that they already were exposed and had it, and that may not be an issue, although we don't know yet if that confers immunity necessarily, but we're making that assumption so far that it is potential, right? And then in terms of the after delivery, not sure yet. Right, because right now most of the New York City hospitals aren't, well, not all, it's mixed who's allowing people after. So I think we should just wait and see on that one. There's some questions about vaccines that will be offered for mother and baby come fall. Are they suggested or unknown? You know, I think they're saying we're at least a year off, maybe longer. So I don't know that will be, that we will know about that. So, you know, again, I think a lot of questions about visitors. I'm just scanning through here because I think I already addressed that. So somebody asked, will hospitals that treat COVID-19 patients, are they going to push mothers out and discharge them earlier to get them out of hospital, and the potential exposure for those of us even who have C-sections? So yes, let's talk about that. Oh, hello, we have a visitor. We are seeing that people are getting asked to leave much more quickly than normal out of hospitals. So 24 hours after a vaginal birth is what's typical right now, and 48 hours, which is 2 days, right, after a cesarean birth, 2 to 3 days, I should say, used to be 4 days. So it really does depend on your body and how you're healing, but they are certainly trying to push people out more quickly, and they are limiting the amount of exposure people are having while they're in the hospital laboring. You're going to have a lot less people coming in and out of the rooms in general, even your own doctor. So, you know, because of the PPE, the protective equipment that they have to wear, the doctors and midwives are finding that it's safer essentially, and because of the amount of time it takes to put all the gear on and off in between patients, that they are not necessarily going in the rooms as frequently. So that's another thing to prepare for. In my class, Confident Birth, Confident Hospital Birth during COVID-19, we talk about a lot of tips and tools to work with if you are, you know, solo in there. So that is something important to note. And you're usually staying for 24 hours because they want to make sure that you get the PKU test, which is a metabolic disorder test that they do in the hospital. And usually you do that at 24 hours. Now, if you do decide to go home, what's called early release, even earlier. I mean, some places, if you're at a birthing center, I didn't ask where you're all giving birth. Oops, I was frozen. Did I come back? If you are at a birthing center, often you do go home earlier, you know, 6 to 12 hours, in which case you have to then go to your pediatrician unless you have somebody doing home visits for that 24-hour test. And that 24-hour test is very important to catch metabolic disorders. Do you know when I went out, Lauren, anything that I needed to know that I missed that I said?
We heard you, but just the video froze a little bit.
Oh, great. Then you heard me, then that is all I care about. Okay, good. So let me see more questions. I'm 30 weeks. I'm working at home as a health worker, which I feel is, you know, being high risk. Should I quit working because my concern that I may not have as much activity at home? It is being recommended on the last OBGYN webinar that we did. And you can look at that, like I said, at our YouTube channel, Get Boober, or on our COVID-19 page. Some of them are. They are recommending that healthcare workers who are pregnant, who are in the direct lines, try to be reassigned so that you are not, you know, either try to be reassigned or take disability or leave early if you can, so that you're not being exposed. Somebody does say, how do I go about telling my family that I don't want any visitors at home after birth? I would the easiest way to do that is to get that from your midwife or OBGYN, right? Ask them. Can they write that down? Can they say, and as long as you can blame somebody else, you can blame all of the experts are saying not to do that. I don't know how far, you know, do they live near you? People are doing these kind of like where you hold your baby by the window. If you live on a first floor or second floor, somewhere that's reasonable, and can you talk to them, you know, from the street? That's not always practical, and not if you live on the 40th floor. But that is one option. And I think you really, you know, the best thing to do is just to put that, just to put that out on the care providers that are telling us what to do right now. Can you talk more about visiting a pediatrician if we'll be at a birth center? Yes. So at the birthing center, they will certainly have, pediatric care there, but that 24-hour test, and it depends where you live actually, but typically they do this 24-hour test, the PKU test, and usually you do need to go, you just go to your pediatrician unless there is a system with your birth center where somebody comes to your home to do the PKU test after. So that's a question to ask your birth center. How do they deal, with the initial testing and blood draws that they need to do? All right. So somebody says, I have a 5-week-old and my family's very eager to hold the baby. When will it be safe to have others hold and take care of my baby, right? So it's really about, I don't know. And it's more about, have they been very quarantined? And then could they come over and combine bubbles with you? That is potentially possible. So follow-up question, pregnant health worker, what are other precautions as some patients, are asymptomatic? So definitely wearing a mask all the time and washing your hands. And those are, I think, the best, frequently, right, that you can do, aside from not being out in the world, that is probably the best that you can do. All right. What is your opinion on perineal massage or other methods to prevent tearing? So perineal massage, it makes sense on some level. Perineal massage is where you actually, while you're pregnant, you massage your perineum. And I'm like, here I am with a thumb on a perineum. I don't have one in front of me. I sometimes do. But the perineum is the skin between the vaginal opening and the anus, right? And so you can actually insert your fingers a little, your very clean fingers, into your vagina and press down and kind of stretch the skin, or somebody else, a partner, could potentially do that with a little more ease and access. The idea makes sense. They haven't done enough studies, truly, controlled studies to know, but on a certain level, it makes some sense, because the more we stretch a tissue, right? If I stretch my hamstrings more every day, I stretch a little more, they get stretchier. I also get used to, so that's one potential benefit, but there might be some loosening. Really what you're actually trying to do though is learn how, instead, when somebody puts their fingers inside to massage you and stretch down a little burning, normally we kegel, right? I squeeze and I hold in and I contract. And you actually want to practice learning that when you feel intense sensation in your perineum, you want to relax and release, that we're bearing down to push the baby down and through. So I actually think that's more of the benefit of using perineal massage, actually to trigger you into, instead of kegling, and that's what, now I'm doing a kegel. Is everybody doing a kegel out there? Right? When you can always see, like, people put their eyes up to the top right or left when they, so you want to just really work on relaxing and releasing when practicing perineal massage. But I can't tell you for sure if that would help reduce tearing or not. And you can talk to your care provider. So any new information on how the virus impacts newborns and young children? Again, newborns and young children are doing the absolute best, right? They may be carriers, or they may get mild illness. Definitely talk to your pediatrician about that. But somebody writes that their toddler school is opening for summer program, and we're debating if we should send her back with the newborn. So another one of those, they thrive in school and miss friends, and I go back to work July 1st, but still might be working at home. Live in Virginia, not as serious as New York City. It's so hard to know, because the second these things relax, right, then all of a sudden the growth can happen. So I would say you really want to talk to your pediatrician about that and really think about that, and try to do the social act. It's so hard, right? Doing social activity through online. But, I think it's more as you are adults, then you're getting exposed to it as well. And we don't want the parents to be getting sick, because you guys have to be well to take care of your children. All right. So, home resources to ensure the baby is gaining weight properly. So I was saying you could have a scale at home if you're adopting a newborn. Yeah, just having a scale and making sure that you are feeding the baby frequently. Newborn babies feed every 1 to 3 hours, and by the time they're a few days old, they're taking it starts at like 1 to 2 ounces per feed and moves on up to 1 to 3 ounces. I can do much more with you on that in the newborn care and bottle feeding class that we have. All right, so let's see. We are almost done. I want to make sure I keep to our time, and I won't be able to get to every question, but I hope you will visit us for more. So I'm just trying to scroll through, because a lot of the questions, some of them we already actually covered. At what age is it safe for a baby to fly, assuming COVID is out of the picture? Okay, if COVID were out of the picture, you know, people often fly, they go into crowds after 1 month or so, often. They say not go into crowds, but they'll say it's okay to kind of go out more into the world. So somewhere between 4 and 8 weeks. But again, I would want to ask the pediatrician about that. Normally, it's easy to fly with a newborn. It's a great time to fly because they're not mobile and needing to walk all over the place. Is postpartum doula an insurance covered provider? No, but we do take, you know, you can do flex spending or health spending accounts, and you might be able to get reimbursed for birth doula or postpartum doula. Definitely for lactation, virtual lactation consulting, much more likely to be reimbursed, but not necessarily. So you try, and the average, you know, postpartum doula is somewhere between $30 to $80 per hour, depending on experience. But there's also, you know, we are working with people during COVID and whatever is working, you know, for people. So there are some sliding scales available as well. All right. So let me just see. Is it worth cutting dairy ahead of breastfeeding to avoid any baby digestion issues? No, I wouldn't cut anything out ahead of breastfeeding. I would wait to see if your baby has a reaction. And if they do, like very fussiness or blood in the stool, or loose diarrhea, you know, then you could deal with it at that time. But if it is part of your diet, it's okay. So I want to purchase my breast pump before having the baby. Is everybody okay? If you're okay to go, Lauren, are you okay to go a little bit longer? We'll end at 7. I'm trying to, so many great questions. This will also, for those of you asking questions, if you came in late, you know, we will send a recording, you know, to people in a follow-up email. So if you didn't get to see all of this. All right. Somebody asked a really good question. Anything different to put in the go bag for the hospital given COVID? Yes. You know, your mask is on your way. You definitely want to have a mask covering or some kind of covering that you're using as a mask. You want to have extra chargers because you may end up needing to virtually connect with your partner. If you're working with a virtual birth doula, of course, then you definitely want to have your laptop or your phone. And there's these, I can never remember the name of it, but it's like a bendy arm, bendable arm that holds a cell phone with a clamp on either side that attaches to your bed and can allow the cell phone to kind of perch up here and be attached to your bed. And that's great for laboring, for virtual support. Also really great when you're doing a virtual lactation visit where you need to get really good angles, but you also need to have your hands free. So I would bring that. I would definitely bring, you know, you might want to bring some comfy loose clothing, but you also might want things. Some people are like, I'm just going to buy a nightgown for after that. I'm just going to leave there so I don't have to bring home my clothes and wash it. So you could think about that. You want to bring, some people are bringing their own hand sanitizer just to make sure that they have it, you know, when they're walking in, although there is a lot of hand sanitizer around, but we're just trying to go straight to the labor and delivery ward. You want to bring some potentially nourishment if you're allowed to eat and drink in labor, which most people should be allowed to, but not always allowed to. So thinking about that, but also just that you can't necessarily order, you're not going to be able to order in the same way. At least in New York, we always used to do that as well. All right. So those are things to think about. And then I would throw in a tennis ball so that if you are solo for some part of it and you need lower back pressure, you can really like sit that right behind your back in the bed. And this is what I do in my Confident Hospital birth at Birthday Presents. You will learn a lot of these tips and tricks. Also headphones with possibly just, you know, your partner on it, talking to you just in case, just if you need their voice, just in case they're not there. Do you advise pregnant women to go outside for walks or just exercise inside? I'm extremely nervous when it comes to going outside. So those of you who have babies and those of you who are pregnant, you know, you can go outside and it can be very healthy to go outside provided you can go outside safely. So it depends where you are. If you are in New York City in a high density environment, of course, it becomes harder because it's hard to maintain 6 feet of space. So as long as you can maintain 6 feet, then, you know, you can go out even just a little and take some pacing, get some fresh air. If you are in a place where you can go out, definitely go out. If you are in New York or any of these other tight places, try going out really early in the morning, right? Like 5:30 in the morning or later at night. Try going at different times if you feel nervous about it, when it's really, really a lot less people. Make sure that when you walk back in, that you should take off your shoes at the door. Some people, if they're really, really being cautious, they're, more likely when they're coming home from the hospital. So you don't, but some people, if you really want to be cautious, then take off all your clothes, wash them. If you want to just, but wash your hands. Always make that a habit, right? When you get back in, just wash your hands. And most people, talk to your midwife or OBGYN, but most of the time they will say yes. As long as you can maintain social distance, you can go outside. Same with having your newborn. You can also go outside with your newborn, provided you can maintain social distance. So if, talk to your pediatrician about that, but that is the advice right now. All right. Are lactation cookies a myth? Other foods to eat to promote milk production? That is a really great question. And we have some different blog posts about that on our site. So at Boober, you can visit the blog and you can see some different things about it. So look, lactation cookies, they have some nutrition in them. They have some vitamins. They have some different, brewer's yeast is a really common supplement in the lactation cookies, because you'll see online tons of people write that when they started taking brewer's yeast supplements, they noticed their milk supply increased. I mean, can we believe all of it? You see a lot of it. So on the first level, there's just like some good vitamins and nutrition. A lot of the lactation cookies have, as long as they don't have a ton of sugar added to them, then you can eat them as nutrition bite. Well, they help you make more milk. The thing that helps you make more milk is enough stimulation, proper stimulation to the breast, right? So the baby has to be feeding well and frequently. So if you're feeding well frequently, you have a good latch, it doesn't hurt you, baby's feeding often and peeing and pooping, but you're still not making enough milk for the baby, or you're like borderline, then you can try lactation cookies and some of the other foods out there. Like you'll hear oats and millet, and you'll hear different things, right? These different tinctures that you can take. But in truth, most of the time when somebody calls us and texts Boober or fills out a form and reaches out and they tell us they're not making enough milk, when we find out how many times a day are they breastfeeding, it turns out it's just not enough times per day, right? So, and then the prescription usually is breastfeed more for a few days and see what happens. And that usually does the trick. But occasionally you will hear from people like they just started eating oats, and I know one person who was so sensitive to oats that it really, really did increase her supply. But I also know plenty of people who eat the cookies and don't see much difference, right? All right, so recommended brand of breast pump. A lot of people really like the Spectra, whatever you can get on your insurance, different things. But that seems to be one that people really, really do like. If you go on our Boober page, there's a products we love page that we recommend that has some different breast pumps. I happen to have this sitting by me. I like the Haka, which is a milk catcher and hand expressing breast pump. It also just attaches to your breast and it catches the leaks from your milk so you don't waste any. So yeah, somebody asks, best way to wash baby's hands, assuming hand sanitizer and alcohol wipes are too strong. Yeah, I would probably use a gentle soap and the kind of soap and water for now. And I would definitely check in with your pediatrician about hand sanitizer and alcohol wipes. I would think that we'd want to avoid them, but you might need to in certain situations, right? If you absolutely couldn't wash the hands and you were out and the baby touched something. So I would check in with your pediatrician on that, and I will get up on that. So a couple more. You guys have so many great questions. I hope that you will come back to our other webinars. Somebody asked a question about the SNU, and I just want to say that we just did a webinar with Dr. Karp, so you can find that at our YouTube page, and you will have an hour of all the stuff about the SNU. It was really interesting, and he went far, and he talks about the SNU quite a lot. So definitely check that out. All right. Let me just see any last question that I could. This is like some people have said that they've heard, last thing I'll say is about induction, because I'll be doing, somebody asked a question about that. I'm doing a webinar. We haven't announced it yet, but it will be next week or two about induction. So I've heard some women are being induced at 38 or 39 weeks due to COVID. Have you heard anything about this? Yes, I have. the reason some people are being induced, although it's still preferable to wait until 39 weeks, which is when the recommendation for induction, where the baby should be, you know, well cooked enough unless you have a clinical reason. There's a controlledness to it that normally even the doctor who I work with, who normally, she has a very low C-section rate and a very low medicalization rate. So she wouldn't normally induce unless there are a real clinical reason to do so, but they are able to test beforehand and have a sense of whether you're positive or negative and be able to set that up and treat, you know, you based on knowing that. Whereas a lot of people who just come in labor, even though they do the test, they don't have the answer for a while. And so they have to treat you as though you're potentially positive, which does shift the care and all of the PPE and all of that. So come check out our other webinar. And again, let me just give you our website for birthday presents. You have code virtual15 for 15% off. And magnetic meat. What is the website? I want to make sure. Or you can take
magneticmeat.com.
Okay. magneticmeat.com to check that out. And of course, get Boober.com. So let me hear out there, was this helpful for you guys? If those of you who are still here, I hope that, you know, if I didn't get to your question, we just had so many amazing questions. I'm glad, you know, we will be putting this up, and I would say you'll get the recording in, sometimes it takes 2 days, 2 to 3 days for us to kind of do what we need to do and get it out, and then it'll be up. All right. So thank you so much to everybody. Thank you, Lauren, for having me. Anything else you want to say to the group?
No, good luck to everybody, and we hope you stay healthy and your family is healthy and safe.
Yes, stay healthy, stay safe. We're here for you. Reach out if you need any care at all. Take care, you guys. Bye.